Welcome to the Journal Club for this week. This is study titled The Efficacy of the Total Numb Now Intraosseous Method for Pulpal Anesthesia in Mandibular First Molar. It's a prospective randomized crossover study that was done by Ohio Group and it was newly published in the JOE. Intraosseous injection allowed direct placement of local anesthetic solution into the cancellous bone. Previous study has shown that intraosseous injection as a primary injection has a high success rate which reached 93% with different systems such as Stabident. The total numb system has the ability to provide an intraosseous injection without the use of perforating a drill. This system used a step-to-juct evolution needle which has a side scalpel bevel that allow the penetration into the cortical bone. This system also consists of a needle guide, which is a plastic sleeve that is placed over the strip-to-juct evolution needle and used as a fulcrum to safely bend the needle in the middle part opposite to the hub, and also act as a rest for the clinician thumb that help in pushing the needle into the bone. So, the aim of this study was to evaluate the pulpal anesthetic efficacy of the TNN intraosseous technique compared with the buccal infiltration in mandibular first molar. Also, to evaluate the pain of the injection, increase in heart rate, lip numbness, postoperative pain for both technique. Now coming to the material and method of this study, they enrolled 104 patients with an inclusion criteria of adult patients who aged between 18 to 65 years old, who had a good health, and the clinical examination of their teeth shows no caries or large restoration or periodontal disease, with no history of trauma or sensitivity. The exclusion criteria involve any patient with allergy to local anesthesia, history of significant medical problem, patient taking central nervous system depressant, pregnant and breastfeeding women. Each patient was randomly assigned to receive 2 sets of injection at 2 separate appointments, which is scheduled at least 2 weeks apart. The first appointment, patient take a conventional buccal infiltration with 1.8 milliliter of 4% articaine with 1 to 1000 epi, followed by a mock injection using a TNN technique with also 4% articaine. In the second appointment, the patient received a mock buccal infiltration with articaine, followed by an intraosseous injection with TNN technique, also with articaine. At the beginning of each appointment, before any injection was given, the experimental tooth, which is the mandibular first molar, and the control teeth, which was the canine, they tested 3 times with pulp test to record the baseline vitality. After that, they use a visual analog scale to record the patient pain for needle insertion, solution deposition for both injections received. This visual analog scale consists of 4 categories: no pain, mild weak pain, moderate pain, and severe pain. Also, in both appointments, after 1 minute of receiving the injection, pulpal anesthesia was recorded using a pulp test, and at 2 minutes, pulpal anesthesia was recorded for the control tooth. This cycle for testing was repeated every 3 minutes for 60 minutes. After that, the patient should complete a survey after the numbness initially disappeared in the same appointment, as well as in the 3 following days after the appointment, and all patients were scheduled for a follow-up at least 1 month after the injection. Coming to the result of this study, first, regarding the pulpal anesthetic success for the mandibular first molar, there was no statistical difference in the success. Buccal infiltration group achieves 42% pulpal anesthesia versus a 49% pulpal anesthesia in the TNN technique. In regard to the pain of the needle insertion, needle perforation, and solution deposition, the pain of solution deposition in the buccal infiltration group was more than the TNN injection. For the visual analog scale means, All were observed in the mild pain category. Only the needle insertion phase in both technique shows one subject in each has filled in the severe pain category. For the patient reporting increase in heart rate, it was significantly higher in the TNN intraosseous technique as it reached 30% increase in heart rate, whereas 15% only observed in the buccal infiltration group. In regard to lip numbness, 100% of the patient experienced lip numbness in the buccal infiltration group versus 49% of them in the TNN group. For the post-operative pain, the TNN technique had a higher level than the buccal infiltration, but both of them shows similar decrease of pain over the time. For both injection, the mean value for post-operative pain observed in the mild pain category, and only 2 patients reported severe pain. For the post-operative signs reported by the patient after buccal infiltration, it was only soreness and slight swelling, whereas in the TNN technique, they reported high occlusion, bruising, soreness, swelling, and necrosis of the papilla. Now, to conclude this study, TNN technique has been advocated as an intraosseous injection, but it would not provide an adequate bulbal anesthesia as the primary injection, as this technique will not deliver the anesthetic solution directly to the cancellous bone. So there is no statistical difference between buccal infiltration and TNN technique. Thank you.